Hello, today I'm going to be discussing signs and symptoms that your body is going into labour, including your waters breaking or releasing. These are important to know so you can be prepared and cope better once labour comes. The cervix is the neck of the womb or uterus, which thins out and opens in order for the baby to come out. There are 3 different stages of labour. The first stage starts with the onset of regular contractions along with the dilation or opening of the cervix, and ends when the cervix is fully open, said to be 10 centimeters. The second stage, also known as the pushing stage, starts when the cervix is at 10 centimeters and ends when the baby is delivered. The third stage is from when the baby is born until when the placenta is delivered. The first stage of labour can be broken down into latent and active stages. The latent phase is the early beginning of labour, which consists of irregular, painful contractions and some cervical changes, as your cervix opens up to 4 centimeters. The active first stage consists of strong, regular contractions and cervical changes, as your cervix continues to open beyond 4 centimeters. These signs and symptoms are what you can feel and see as your body starts to go into labour. But it's important to be aware that these signs and symptoms will differ amongst women since every body and birth is different. You could experience all, some, or none of these signs and symptoms. One sign of labour you've probably already heard about already. You probably know that your water's breaking is a sign that you're going into labour. Although you might not be aware that it can happen before labour, in early or active labour, or not at all until your baby is born. As the baby descends, the head puts pressure on the membranes, which is like a balloon, which contains the water surrounding your baby, and so the membranes burst and your waters break through. This can happen in a big gush or trickle. The normal colour for your waters would be clear, sometimes described as straw-coloured or creamy white, possibly with a tinge of pink. A green-black colour would mean that the baby's had a poo in the water. Midwives call this meconium. It could be a sign that the baby is a little bit stressed or just ready to use their bowels. If your waters break, it's important to note the colour so that you can let your midwife know. It's also a good idea to use a maternity pad so that you can catch any leaking water and show your midwife the colour. If you notice your waters to be a red or green-black colour, make sure to contact the hospital immediately. If you think your waters have broken, you should call the hospital for advice, as they may ask you to come in. If your waters break before you are 37 weeks pregnant, this could suggest preterm labour. Therefore, you should contact the hospital immediately. Sometimes waters can break before your labour starts. This is called premature rupture of membranes, or PROM for short. Research shows that if waters break before going into labour, most often people go into labour within the next 24 to 48 hours. If that doesn't happen, you might just need some assistance to get started going into labour. Very rarely, waters don't break at all, and the baby is born inside its bag of waters, also known as the amniotic sac. One important thing to remember as you reach the end of your pregnancy and start to notice signs and symptoms is to think about your baby's movements. You may hear people say that it's normal for babies to move less towards the end of your pregnancy, but this is false, as babies continue to move during labour and birth. Your midwife will discuss your baby's movements with you at your antenatal appointments. You may notice a pattern in your baby's movements, and it's important to notice what is normal for your baby. If you notice your baby is not moving as they usually do, make sure to contact your maternity team or midwife to get it checked out immediately.